Hi. In today's conversation, I'd like to share a few things about the role of leadership in medical writing. In this conversation, leadership differs from the traditional definition of leadership, where one would think about moving higher in the hierarchy within an organization. That would be the more traditional definition of leadership. Here, however, we're talking about leadership as a process, leading people in document development. And that is crucial for any medical writer. And this is something that I have learned in my time being a medical writer in a fairly large organization. Um, One of the phrases which is used often within the medical writing world is that a medical writer owns the process without owning the document. What does that mean, really? It means that as medical writers, more often than not, we may not have our name appear on a document. To give you an example, when a scientist publishes a review or writes a chapter of a book or publishes a paper, their name is right there on the title page. However, when a medical writer writes a clinical trial summary or a clinical research summary or a regulatory document, our names don't appear on the front cover. However, we play a crucial role in leading document development even though we don't own that document. Now, what does it mean to lead document development? It means to be the glue that brings teams together. What does that mean, really? Let me explain with an example which provides an overview of how the medical writer would be the glue in a team. So as an example, let's say a new project is assigned, a new project comes in, a large organization wins a proposal for a new project with a client. The first thing the medical writer would do is to either reach out to the client directly or reach out to the business person or a manager who's liaising with the client frequently and collect the client's expectations on how this project should be conducted and what the final deliverable should look like in terms of the timeline, in terms of when it needs to be submitted, what kind of document it is, and so on. And then the medical writer would bring those expectations into the company and talk about those expectations with the internal team of scientists and other medical writers and physicians and doctors and so on. So already the medical writer has played a role in bringing these expectations to the team and pulling in the team together and making sure everyone is on the right page. Once that's done, the internal team can then liaise with the external team, which is the team of scientists and physicians and so on in the client organization. So now the medical writer is going to play the role of moderating this interaction. So then again, leadership skills really comes into play. And this happens repeatedly, where the medical writer would go in, develop the document a little bit, liaise with the internal team, and then liaise with the external team. And this process goes back and forth until each draft is reviewed internally as well as externally. And finally, the medical writer has to make sure that the project is delivered on time, per expectations, per the requirements of the client. So you can imagine the level of leadership skills, team management skills, and time management skills, which also fall under leadership skills, are involved here in the medical writing role. So think about that. Think about instances where you have been the glue in a team, where you have brought people together in a discussion, where you have brought ideas together and played a role in projecting that idea to either the internal team or an external team, and talk about these things when you are facing your next medical writer interview. And think about the phrase in the medical writing field: although medical writers don't own the document, we lead document development, and thereby play an essential role in demonstrating leadership skills in our everyday work. All the best.